Well, first of all, welcome to everyone. Today, this is our second forum for foot care nurses for discussion and dialogue. We had such an overwhelming response last week with almost 200 of you on the call that we thought we should have an opportunity to meet again. Doris Grinspun is going to be joining the call today, but she's unavailable at the moment, so she'll join as soon as she possibly can. But we do have a pretty packed agenda and wanted to share some information with you about activities underway since we last met. So I know many of you were on the call last Thursday, which was less than a week ago, and it seems that the time's gone extremely quickly. So I'll just take a moment to do some introductions, just in case some of you were not on the call last week. One of the things and the outcomes and next steps from our discussion from last week was that became fairly evident that there needed to be some kind of a collated resource for protocols for resuming practice. And so Doris charged us with moving that ahead with a working group. So believe it or not, since last Thursday, we've actually met with a small group of those that were in attendance last week and volunteered to help. We had a meeting with them earlier this week to start thinking about what some of the elements would need to be put in place in order to support resuming practice. So we're going to share those with you today. And what we'd like to do is take the time during that review to get your feedback, input, get your questions about each of the elements so that we can ensure that those areas of issue are addressed throughout. And I'll explain to you who we've also been working with and the resources that we've looked at while we review that part of the agenda. We'll take a moment to check the pulse and just see if there's any outstanding questions or issues. Bev has been collated the many questions that came through the chat box last time. I can say, and we talked about this last week, the activity in the chat last week was just amazing. So we'll see how we manage today and being able to keep up with that. But the questions that you're asking are helping to guide us with some of the resource, either creation or more appropriately compilation, that we can pull some of these tools and resources together to help support you in your practice. And then we'll look to see any additional supports that might be needed and next steps for us and for this group. So by all means, in the meanwhile, don't hesitate to include any questions in the chat box. Catherine, Melissa, and Bev will be moderating the chat while I'm kind of facilitating our call today. And by all means, if you've got questions or comments or help supports for others, please don't hesitate to use that means of communication. I will say that last week's chat box not only included a lot of questions and comments, but a lot of support from each of you to others with answering their questions and needs for information. So let's hope that we have that similar experience today. So our numbers are continuing to grow. And so let's move on to some introductions. So I just wanted to say that Doris Grinspun, as I said, will be here with us hopefully later on this afternoon. Myself, Heather McConnell, I'm the Associate Director for Guideline Implementation and Knowledge Transfer. Bev, do you want to introduce yourself?
Yeah, I have to unmute myself before I can do that, don't I?
Yeah, that's okay.
That's a good start. I'm Bev Colbert. I'm a long-term care best practice coordinator, and as of today, I've been in my role for 13 years, and I support the long-term care homes from Windsor to London in the implementation of best practices. So I am helping to gather resources that I can find, and I certainly don't have the level of expertise this group does. So feel free to provide me with any feedback or any additional resources that you feel I would be helpful for the group, and I will gladly include them. So anyway, thank you for joining us, and it's a pleasure to hear from all of you.
Thanks, Beth. Catherine.
Hi, everyone. My name's Catherine. I am a nursing policy analyst at RNAO.
Great. Thank you, Catherine. And Melissa.
Hi, good afternoon, everyone. My name is Melissa. I work in the IBPG Center as a project coordinator, and I also work with our international BPSOs.
Great. So this is the RNAO team that will be facilitating the call today and supporting any follow-up that we need to address as we go forward. So with that, I'm going to move along in our presentation today. And as I said, our objective after last week, or our ask for after last week, was to start talking about what the considerations for resuming practice. I'll say it that way. And of course, there's many different practice situations that foot care nurses find themselves in, whether they're in independent practice, they're working in clinics, they're working for an agency that does home visits, they may visit in retirement homes, long-term care, have a home-based practice, etc. So we really wanted to try and get input and ideas about the structure of such a protocol from a variety of different perspectives. And so I just do want to acknowledge that we had a number of individuals that supported this work. We met just very briefly earlier this week to kind of have this discussion, but those of us on the call right now, we're all in attendance at that meeting. And I also want to acknowledge the six nurses who, or six individuals who were in attendance at that meeting to provide support. So we had Jane, who works in an area of an organization that provides services both in the clinics, long-term care, and private homes. We had Kim on the line, who focuses on work in home care, clinic, and retirement homes. Sue, who worked on Manitoulin Island in a health center. Romy, who worked as a foot care nurse, a foot care educator, and also participated on the IPACT Canada working group for foot care practices. Rita, who works in congregate settings and seniors housing, and Janelle Marie, who works in community and assisted living. So we spent about an hour together and really brainstormed and thought about the various elements of a protocol that might be necessary. And again, I recognize that there are people that have, or organizations that have expertise in foot care that we are going to be connecting with to help do this work collectively. But we thought we should probably have a bit of a brainstorm first to get a sense of, you know, what are the kinds of issues, what are the questions, what are the elements of a protocol that would help support a return to practice. So as I mentioned at the beginning, what we've done is we've identified a number of elements that we all agreed needed to be considered in terms of returning to practice. These may not be inclusive enough, so by all means, we'd appreciate any of your comments related to areas that you think we may have missed. So what I'd like to do now is take you through each one of these 5 elements. What we'd like to try and do is get your feedback and comments about these elements. So please feel free to put in the chat any questions you might have related to the element that we're discussing, any expertise or experience you might have working with clients in the COVID era that you might think could help contribute to the discussion. And what we'll do is we'll use your input to be able to help pull together some resources that answer those questions in each of these areas of category. So I'm just going to stop there and see Bev, Melissa, or Catherine, do you have anything else to add in terms of just some context for the discussion that we'd like to have next?
I don't think so, Heather. I think you covered it all off nicely. Thank you.
I agree.
Okay. So hopefully those on the phone agrees, or on the call agree. So I'm just going to check and make sure if there's anything that people may want more information on now before we start moving into the various different elements. Or is it pretty clear what we're wanting to achieve today? Just put in the chat. If it's clear, just put yes. And if it's not clear, tell me what more information you need. Okay, so it's yes, yes, yes. Okay, and we got some hands raised there too. Okay.
I just had one comment, sorry, Heather, about
go ahead.
setting. We had a comment there. Sorry, I'm trying to find it. The only item I would include is setting.
Yeah, so we'll come to that. Yeah, absolutely. Yeah. So we'll come to that next, because I think the setting is going to impact on all of these elements. So we didn't see setting as a separate entity. It was almost as if within each of these elements, a setting needed to be considered. So we'll go to the next slide. It sounds as if people are clear on what we're wanting to accomplish here. So let's move to the next. Actually, well, let's just review. So it's establishing essential care. So that became and a number of questions that we had last week is, you know, can I provide foot care? When are we going to open? What are the next steps for me? So it became fairly evident that we needed to have an element around establishing essential care and the context of that within the directives from the ministry during this time of emergency. The second element was screening of clients and how that might be done in different practice areas. Personal protective equipment requirements for practitioner and client. Equipment, care, transportation, and cleaning. We had a lot of discussion around particularly in those that are providing community services, how do you get that equipment and PPE out of the home in a safe way and get it to where it needs to be cleaned and disinfected, and then elements around accountability. So I'm going to just move to establishing essential care. So this is in the context, as I said, around Directives 1 and 3. The Ontario Port Authority Nurses Association have provided essential guidance to differentiate essential services versus non-essential services. And this is actually a really helpful document to look at. That did circulate it last week in the resources that we circulated. But there's a really good list of clinical indicators where essential services are clear, and then indicating where it may not be essential right now during this COVID pandemic. And so it really becomes a critical component of reflection and assessment that needs to be done by the practitioner to be able to determine whether or not the service is essential or not. And Bev and Catherine, I'm just going to turn to you. Do you have any comments or anything you'd like to add to that?
I think I'll let you take it away because I know you have been more involved in this specific resource.
Okay, I don't know why for some reason my unmute doesn't want to unmute as fast as I would like it to. So if you can delay, that's what.
Go ahead.
I am just wanting to let the group know that these directives seem to be changing day by day, and even within the last half hour, there's been a change to Directive number 3. So when we're talking about the essential care piece, that's based on information from this morning and before. So there are appears to be some consideration for what is considered essential. The best place to find that information was from the Ontario Port Authority Nurses Association. And I would suggest that it is applicable probably to all settings.
I think it looks to me as if what the bottom line is here is that if there's a potential negative outcome for the client in terms of infection, skin damage, loss of a limb, obviously, all those sorts of things, then that's essential care. Regular maintenance may or may not be, depending on what the client's comorbidities are, etc. So it's really important that you have a look at that document and then think about your own settings. So when we were looking at settings, we kind of identified 3 big clusters. And again, this will be dependent. So there's congregate living, which would include long-term care, retirement homes, and group homes. And each one of those right now has similar but slightly variant requirements for services that are being provided within those settings, and you'll be familiar with that. But again, please keep an eye on the ministry's resources, but we'll pull the links from where you would find that information into the sort of overall resource so that you're very clear on where you need to look depending on the patient population that you're caring for. Clinics, we included home clinics where there's a separate entrance where it's actually a separate clinic. Where because that's a slightly different circumstance, obviously, when individuals are coming to you for care, and then again, home visits, and how do you determine an essential visit when you may not have seen that client for a period of time. So those are the elements around being able to do that assessment of essential. And I just wanted to check and see, I'm going to have a quick look in, yep, they've got some nice, thank you. So we've got a number of people asking questions about whether it's essential or not. And again, I think we've had some tools that have been shared and people are referring people back to the OPNA website, which again will provide you with some of that information. And it may not cover all circumstances, but it'll give you some thoughts in terms of being able to reflect on the element of establishing essential care, because right now we are providing essential care, or to be providing essential care only. And I think that's a big decision that needs to be made right up front before we can even move to the next stages of returning to practice.
So Heather,
So,
I can just expand on that as well because
sure,
I've just
please do.
thought of something while you were talking. So, and I
Mhm.
forget where I read it, but it was on one of the regulatory sites for regulated professionals. And when they talked about essential foot care, non-essential foot care, I think for me, it sort of came across when I read it as, you know, there's basic foot care and then there's advanced foot care needs. And so the distinction in this document or this resource that I read was most nurses can provide basic foot care. So if you're into a, I'm going to say a long-term care home setting or retirement home, they were really recommending that the frontline nurses in that home can do, you know, can cut the toenails or provide foot care if it's basic foot care. So they're trying to minimize the risk of COVID coming into some of these organizations. So I worked in long-term care, and I have to say, like, everybody in long-term care loves a foot care nurse coming in. They visit for half an hour, they soak your feet. It's somebody different to talk to. And it's a very positive experience for them. But I think the people who are going to have adverse outcomes, you know, if they are diabetic and their feet are not just basic trimming of the toenails, and that would be sort of some of the criteria you would need to consider. So is it a difference between a frontline nurse? Yeah, I see that we don't soak feet. I know some people, but they do in long-term care. I hate to say it. So they, some of the nurses or some of the nurses can do trim the toenails so they're not too long if there's no risk associated with that, I guess. So that was sort of what I read in my research.
Yeah, and again, I think there's a difference between sort of advanced foot care, which is the practice, and then whether or not the service being provided to the client is essential. And so that's where the distinction is too. We're getting a lot of questions in the chat about that. We'll try and answer the question about the ventilation. I'm not sure we can answer that right now. We might have to go back and do a little bit of investigating. But just want to say that we did acknowledge your question. That was in the question and answer box, Catherine and Bev, just for your information. Okay, so this is about essential care, and I think this is the question, and you know, I don't think we can compare some essential services to others. You are going in to provide care in close proximity to individuals who are needing the service, and so this takes us into the screening of clients. And so pre-screening may need the assistance of a family member or an off-site staff or an on-site staff member. So with our group that we had together, we talked quite extensively about the process for screening. And it is important that you as a healthcare provider do that risk assessment and not only the risk assessment, but also the screening of those that you're providing care for. And it became fairly evident that there were different approaches to be considered in this area. So for example, if you have a clinic, and Catherine, I don't know if you, Catherine or Bev, if you want to talk a little bit about, you know, what we discussed related to different processes for screening, or would you like me just to continue?
I think, Heather, there's a lot of information on that resource list on pre-screening, but they do really recommend that it's not just a screening of the client, and it should be done daily if you're in an organization where you might be going in regularly, but to also look at the family members who may be at risk or who may be putting you at risk. So, you know, it's for the protection of the client and also for yourself.
Right. So if you're managing a clinic, for example, you might want to do pre-screening the day before. You know, you may be in a situation where you can do online screening the day ahead of time and have individuals answer those questions. Again, depending on your client population and whether or not they would be able to actually do an online screen. But certainly by phone the day before to determine whether or not the screening questions that are being provided by Public Health Ontario, those are the ones that you really want to focus on. And make sure that you've done that due diligence before the individual comes to the clinic. Home visits, as Bev said, if you're going into the home, you need to do a screen the day before or the day of, and then ask about the family member's status. So this particular recommendation came from one of the foot care groups, and you know, you are in a situation where you're going into a home. You may be caring directly for the client, but there will be other people in the home potentially. And so it is appropriate for you to ask. They won't necessarily have to complete your screen, but you should know whether anybody else in the house is in quarantine for COVID, etc. So that may make a change to how you might approach your visit. And then congregate living. Now this was an interesting discussion we had, and I think it was Jane that spoke about this, and having staff that were actually working in the congregate living settings, so retirement homes that were not in COVID outbreak, or potentially in a group home setting where there's a staff member that could actually help support the screening. In this case, it was in the language, the primary language of the congregate living setting. If it was a retirement home, had residents with various different backgrounds and different primary languages. And so the screening was actually supported by individuals working in the retirement home who had those language skills. And they were actually, if they passed the screen, were able to provide the resident with instructions about needing to wear a mask, and the details about what to expect for the visit. And that information and the screen was actually shared with the staff member when they come into the home, so or come into the building. So that's how they're planning to deal with that, because they're not going to be able to, once they get into the home, they're not going to necessarily be able to screen everybody in the language in which people would be able to understand the questions and respond appropriately. So that's what the steps that they put in that very specific circumstance. So that's an important thing to think about. You know, if you are in those circumstances, how would you screen your clients if they're in a long-term care home? They're in a slightly different circumstance because they are being screened regularly by the staff. But in a retirement home, they may or may not be, depending, or in a group home. So again, you really need to look at those current requirements for a screening before you start your practice. So then, of course, if they've got a negative screen, you can confirm the appointment. Oops, sorry, let me just go back here. Sorry, I didn't touch anything, but let's just see here. And then many clinics in particular are actually doing temperature confirmations, so that after you've passed your positives, you pass your screen, the client has passed their screen, they come into the clinic or into the area which they're going to be provided care. They actually do temperatures as well to confirm that individuals are not feverish prior to providing care. So I'm going to just stop there and see what comments, questions, ideas people have, suggestions you have about screening in your particular area of practice. And you might want to just indicate whether you're working in home care clinics, etc.
Heather, I just want to add, it's Bev. I just want to add today, along the lines of screening of clients in long-term care, the staff are being told they have to be tested now twice a month, everybody.
Yes, that's correct. Yep.
Yeah, so
Yeah,
I'm suggesting that if anybody is going into long-term care homes, they may also be subjected to that same testing.
Mm-hmm. Yeah. Okay, and somebody's just asking about asymptomatics people. Do we need to give them take their temperature or not? I'm not saying you have to, but I know a lot of clinics that have started reopening this past week are actually doing that, because we know that individuals may be asymptomatic on one day and have symptoms the next. So some clinics are putting that into place. So it might be something that you want to consider with an infrared thermometer, for example, which are relatively inexpensive in the big scheme of things. Yeah. And so somebody else is here. Yeah, and somebody else. So go ahead.
In the chat box, there's a lot of comments saying that they are technical temps.
Yeah, I'm seeing that. So that's good. So again, anything that you've got to suggest in terms of approaches for that, particularly in different circumstances, whether it be through a clinic or a home visit, because those are very different circumstances to try and then somebody else is telling them that they'll be taking temperatures of all the members of the house. And again, I think this is a risk assessment you're doing. You're going into their home to provide care, but you're also going into their home not necessarily knowing the circumstances of all the individuals in that home. And so obviously they have the right to privacy in terms of their healthcare information, but you also need to be sure that you're comfortable and able to provide services in the way in which you want and giving that high quality resident-centered care. Yeah, and so I would call before you arrive in the home. Absolutely. So all of these things. So don't just do the screening when you get there. You need to do the screening ahead of time and make sure that it's appropriate for you to visit that individual. And again, because of your population, you may find that you need to get family members to help support the screening for those clients that you're either visiting in the home or even in the clinic for that matter. They may be needing to help transport them to the clinic or come with them in various different ways to support their visits. So just to think about that in terms of this whole issue around screening, because it's a big one and it will look different in each of your different settings. So I'm going to move on. I'm just keeping an eye on the time here, and I think we're doing well. Well, actually, let me just check and see first, Catherine, and have any questions or comments in this chat box that you think we need to emphasize?
I'm just going through. I'm reading some of the questions have been answered by some other members. There was a specific question about doing temperature checks even if the patient or resident has screened negative, and I think some others have suggested, yes, you should do it. And I can't see anything else.
I didn't see anything either.
Yeah, that's a good, that's a good. Yeah. Okay, and I'm just saying that some people are talking about clinics and.
Yes.
Sorry, go ahead, Beth.
I was just going to say, and another point I just wanted to raise, and it might come up later, so I'm sorry if this is too early, but when we're screening a client, it would probably be really good to advise if there are multiple people in the home that you're going into or the clinic you're going into about the social distancing, you know, and that we have to maintain that 6 feet apart as well.
Yeah. Okay. Okay, and they're just saying, one individual's just suggesting that for clinics that you have people wait outside so that you don't have a large number of people. I would suggest that you're really trying to minimize interaction between clients. So even considering the timing of bookings of appointments, et cetera, that you may not be able to see as many people in a day as you normally would, and that you'd need to limit their interaction with each other, as well as being able to screen them when they or you know, deal appropriately with them in terms of physical distancing when people arrive at the clinic. So
and
that's
there's
a really
question here, Heather, about signing the screening form. Should the client be signing the screening form? That's a good question. I don't know.
I don't think you have to I don't think it's absolutely necessary. I think it needs to be completed. Obviously, if it's done online and if somebody's completing it, it makes sense to have them sign it. But in other cases, individuals are being screened by you know, healthcare providers and that are asking the questions directly and not necessarily signing. So I think that the issue is whether or not the screening has been completed, and whether or not you may need assistance with the screening if an individual does not speak the language that you do, or have some cognitive impairment that might need some assistance. Okay, yeah, and somebody's just saying, I ask the questions and I sign it, decreases contact. Yeah, because when you've got, there's now starting to get people to sign things, paperwork, pens, etc. So the less contact, the better. But again, you know, you really need to just think of a consistent approach that you're going to take, and know that screening is a part of the care that you're providing now. Okay, so shall we move on to the next element? Okay, so let's move on. So PPE, practitioner and client. So we had a lot of talk about this. So, and I don't know, Melissa, is Romy on the phone? She wanted to join us as a panelist, and I'm not sure if she is on the call today or not.
Let me just take a look right now.
Okay, please, thank you. So we looked at a number of different resources for this. I had a lot of discussion about PPE. So first of all, yes, hand sanitizing for practitioner and clients is required before treatment. So everybody obviously needs to do that as part of their general care. Both PPE is required for both the practitioner and for the client. And so, you know, we had some discussions around whose responsibility is it to provide the PPE. And again, I think it may be dependent on the practice environment in which you're working, but I would see that ultimately it's a responsibility of the practitioner to make sure that the client is wearing PPE. And what's required for the client is basically a mask. For the PPE for the practitioner, the Foot Care Nurses Certification Board is recommending full PPE. The IPACT Canada also has recommendations for PPE that are specific to foot care generally, and certainly would be consistent with a good practice approaches ongoingly for infection prevention and control in the area of foot care. And that's actually a really helpful document that we shared with you last week. And Romy was on this IPACT Canada groups, which is just why I was wondering if she may have been on the call that might want to share with us her insights into that. And again, the Ontario Port Ortho Nurses Association has some recommendations around this too. What the bottom line seems to be is that they're suggesting that you err on the side of caution and utilize a PPE to ensure that you don't, particularly if you're moving from place to place, that you're not inadvertently bringing COVID from one client to the next. So have a look at those resources. I'm just looking at the chat here. PPE, where you can get it, there's lots of different places. Certainly it's being recommended federally that Canada.ca has listings of resources for PPE. I can see Tom's on the list on the chat right now, and people are looking to him because he's able to help support some of that work. So again, just try to remember that that PPE is important, and obviously PPE is important, that's a bit redundant, but that it's a critical aspect of your care. And it's not only a matter of putting the PPE on, but it's also removing it and transferring it appropriately after removal. So one of the things we did talk about yesterday was the need for shoe coverings in homes if you're going into others individuals' homes. And those blue shoe coverings that just kind of slip on over top of your shoes, so that because you're going to be moving from their home to your car, etc., and it's important to consider that as well. And there hasn't been much discussion about that actually in the various different resources we looked at, but certainly the discussion that we had with that small working group yesterday really felt that that was an important aspect of care. So I'm just going to check with Catherine and Melissa to see if there's anything that we need to address in the chat. Again, if you can add any questions that you have about this here, we may not be able to answer them now, but that'll help guide us as to what kind of information we should include in a sort of a draft protocol that we can share.
Heather, I just want to add, while they're looking through the chat too, there's a lot of requests for N95, or a lot of questions about N95, and my understanding is N95 is required if somebody's COVID positive, and that a surgical mask is adequate for all other areas of care.
That's my understanding too, but I think certainly they're recommending that you might want to consider masks and face shields, etc. But yeah, it's really intended for those that are COVID positive that we know of, but also, certainly in the hospitals, long-term care, they're using them for aerosolized procedures. So you just have to kind of keep that in mind while you're making your plans to go back into the workplace.
Well, I just learned something new. In the chat box, they're saying the N95 is standard for chiropody.
Oh, okay. Well, there you go. Well, then that's standard for chiropody on a regular basis. Then that would be, I would imagine, considered on.
Yeah, I want to thank everybody for putting these comments in the chat, because that really is what this is all about, to hear from the experts, which are you. We're just facilitating this discussion for your benefit. Yeah,
excellent. So that was again, if that's the requirement for foot care, then and that would make sense, because it's not aerosol. In that case, it may not be related to aerosolized, but it could be related to aerosolized. No, that's not the right. How do I describe that? Anyway, I understand what you're saying, that it's that the actual procedure of foot care could in fact aerosolize other products into the air, not necessarily COVID. Okay, fungus. Thank you. That's what I was trying to come up with. Thank you. Okay. All right. I think so. This has been a good discussion here. There's lots. It's particulars. Particulars, not aerosol. So thank you for that. And the IPACT document, we've talked about that as well. Okay. anything else in this particular element? This is a big issue, and I think it has to be recognized that you've got your own regular standards for PPE for delivery of foot care treatments. So those should be in place consistently, and now we're adding in some additional things for COVID specifically, and particularly in those circumstances where the control of the environment may not be as easy to do as it might be in a clinic where you've got an ability to clean surfaces regularly, etc. So just kind of think about that as you're working your way through the process of returning back to practice. Okay, I'm going to go on to the next one here. And this was about equipment, care, transportation, and cleaning. So again, these are just the things we spoke about while we were together this earlier this week. And we've already talked about, oh, sorry, hang on a second, I beg your pardon, I leaned on my
I just wanted to tell you too, while you're clicking your slide block, I think it looks like Romy might be on in the chat.
Okay, well,
I'm searching Romy's name and I do not see it. So unless it's under a different name or
Foot care forum, somebody said.
There we go. Okay. So if it's under foot care,
I believe Romy might be on as foot care forum.
I've just promoted foot care forum to panelist, so we will see if it's Romy.
we probably could have confirmed that before we promoted her, but anyway, it's okay. Let's do it one by one.
Yeah.
It's
Romy, that's you.
I am. Is that Romy?
Yes, it is. Yeah,
okay, good. Sorry, we couldn't find you.
Hi, everyone.
Romy, do you want to just, I'm going to go back to this previous slide, and we've invited her to come and join us on the panel because she was one of the individuals that was with us yesterday or Monday, I can't remember what day it was, and really was actively involved in the IPACT Canada development of those recommendations. So we're glad to have her with us. And Romy, do you want to emphasize any of that we've talked about, or did we forget to mention anything that we talked about yesterday that you think needs to be highlighted here? Because this is probably the area where we're getting the most questions.
The transportation of the tools. Now, I would suggest for all the nurses to actually review the IPACT Canada, the tool, the best practices today with providing foot care. So transportation of how the tools are done. Now, the issue is in light of COVID, if an individual is providing care in the home, they're using the full PPE. And this is not just from IPACT Canada, this is the Foot Care Nurse Certification Group. What they need to do is to discard the soiled PPE and place it in a sealed plastic bag, and preferably not to take it with them. If they can leave it at the client's home, that will be pretty good. If they can leave the dirty soiled tools there, that is the disposable cover as well as the whole full PPE. And the reason for this is that we need to remember that we need to assume that the client, whether they're positive or negative, they may even be positive and we don't know. There might be family members in the home. So we suggest when the foot care nurse go in there and they discard off their PPEs, just to basically place it in a seal-proof plastic bag and possibly leave it there and discard it in the client's garbage.
Okay, so then thinking about being able to actually get out of the home and sort of that closing of the visit, being able to actually deal with that there. And of course, if not, then being able to maybe bag or double bag the soiled, or not the used, I guess, PPE as you're leaving and maybe moving to your car. Would that be appropriate?
Yes, that would be. Regarding the tools, IPACT has some excellent information there, how the ladies can still clean their tools and just place it in a seal-proof container. Now, for what we advocate to, because we don't want the nurses to take stuff away from them. Yes, they will be able to clean the tools if they can, but what we would actually suggest is a single-use disposable tools that can be discarded as well in a seal-proof container. That's what we would suggest as well. But some
So
people,
that would be a recommendation.
That's our recommendations for the nurses in particularly, if you really want to, because if you really want to make sure that you're safe and you want to try to keep something in one place. But if the nurse is using reusable tools, and we're quite aware of this, is that what they need to do is they do need to clean the organic matter off the tools and put it in a seal-proof container, and then they could travel with it. And of course, they need to do the proper sterilization. We don't suggest the high-level disinfectant today. We do prefer the sterilization with that method, the steam sterilization, as opposed to the high-level disinfectant.
Okay, great, Romy. So if I was a foot care nurse and I was visiting in a home, I've dealt with my PPE, and before I take my PPE off, am I going to remove the organic matter from my equipment before I put it in some kind of a bag to remove it from the home?
Yes.
Yeah, and then I would put it in my sealed container when I got to my car. I'm just thinking about the logistics of this.
Yeah, well, what you'll do, you'll try to clean the organic matter off, and then you'll put it in either one of these autoclave type pouch or in a seal container. So when soap and water will actually kill the virus. So as you clean it, then you're just going to be traveling it, possibly having another container that you can put a seal proof, preferably, that you can take home, and then you're doing your sterilization. Okay. But if you're worried about the virus, because we can't see the virus, we just need to be very mindful. A single use, preferably that would be very disposable tools would be much better.
Okay, we've got somebody asking and saying that they understand that instruments must be in an enzymatic immersion solution for transport. Can you comment on that?
That is true, yeah, and it's got to be moist.
Yeah. Okay. Any other questions, Catherine or Bev, that you're seeing that we might be able to get Romy's input into?
Hi, Heather and Romy. There is a question here that I see from someone who has concerns of taking off the PPE and having their clothing exposed.
In having their clothing exposed, taking the PPE off and having their clothing exposed, we would suggest that under the actual PPE, the nurse can also use, a plastic disposable gown. You can get these from places like Stevens Medical. So you put that on first, and then you put the yellow exposure gown on top. So it means then that when you take that PPE off, then you take off that disposable sort of a gown, that it's not the virus won't be then on your clothing. So those are pretty cost effective, using the plastic disposable gowns as well during treatment.
Okay. Yeah. Okay. Catherine and Bev, Melissa, any other questions? It looks like there's a lot coming in through here. I'm just wondering if we could have any that we could direct to Romy.
Mask called P100, which it looks like Tom has given some info about. Romy, I don't know, can you speak to what this mask is and if it's similar or has the same protection that an N95 provides?
I can't see it.
Have you heard of this P100 mask before? I think Tom is saying here, P100 is cleanable, reusable, and has a long life. Just need to use the right disinfectant, as most will damage it. P100 also has better filtration than N95.
Oh, is it? And you have to disinfect that N95 mask? Or I haven't heard of that. So I'm going to have to review that with my team and see, because I haven't heard about that one.
Okay, thank you.
Okay.
So Tom and I we can probably talk afterwards and see, but I haven't heard about that one.
Okay, thank you.
Looks like there's discussions about actually disinfecting. It's a mask for toxic chemicals superior to N95, Tom's saying. Okay. And in terms of actually cleaning and disinfecting the tools after use, Robbie, then, so basically soap and water to clean them, and then the regular process that the foot care nurses would be using to sterilize their equipment would still be appropriate. Is that correct?
Yes. Yeah. Okay. The steam sterilization. not the high-level disinfectant.
Okay. Steam sterilization, not high-level disinfectant. Okay. Good. Thank you.
So the best practices today, it's either steam sterilization. So many of the nurses will need to have to purchase an autoclave or use the single-use disposable tools that can be discarded in a seal-proof, Health Canada approved sharps container.
Okay. Good. What other questions are coming through here? Bev and Catherine, Melissa. Just want to take advantage of the opportunity now that we've got you on the call here, Romy.
Mm-hmm.
That's okay.
Just looking through the chat now to see if there's any other themes we can address.
Lots of good reference to people are directing people to different resources that they've been utilizing, Health Canada, CDC. Yeah. Okay.
The IPACT Standards for foot care is an excellent document because that, like, for a few years that the team was working on that, and it looks at all the current best practices, like why you use single-use disposable tools, why you use an N95, why you use PPEs and so forth. So, and even how you clean your tools. So I definitely would advocate for every nurse to review both documents, one for sterilization of the tools and the one for foot care, providing foot care in healthcare settings.
Yeah, good. Okay, super. All right, I think we've got most of the questions covered. Oh, somebody's asking about the bag that they transport their tools in. Should we cover this or leave it outside and only bring what's necessary into the home?
I would cover that.
Mm-hmm. And would you take it into the home?
What's that? Sorry, can you repeat that again?
Sure, they're just asking about the bag that they use to transport their tools in. Should we cover this or leave it outside and only bring in what's necessary into the home?
Okay, well, today we don't advocate for the use of the bags. We would prefer like a toolbox, and with a toolbox, you can get these from any of the hardware store, a plastic toolbox. And what you can do is when you leave the client home, you actually clean it with a hydrogen peroxide wipe. So basically it's plastic, you can take it in, and whatever it is that may be on that toolbox, you can just wipe it all off. And Walmart, as well as Home Depot, Lowe's have some nice toolboxes that one can purchase. We don't advocate for the bags, for you to have the bags today.
And really, you'll really only want to be taking in what you absolutely need to have in the home for the care being provided, right? Yeah.
Yes, yes.
Yeah. People are saying that they agree with the toolbox. There's also other, professional resources to do that. And some people are putting supplies into large freezer bags to take them into the home, etc. Okay. Okay, I think that's covered a lot of the questions. There's a lot more still, but I'm just relying on my colleagues here to keeping an eye on it while we've been talking. So is there anything else? Somebody's asking about, has anybody used single-use foot care tools? Are they strong enough for cutting, cleaning, and filing?
Right now there is the foot care tools there is a set of 3 tools. So it's got the black file, it's got like a small little foot file, and the nipper, the nail nipper, and it's very effective. You can actually get that from Supramed, and they're actually in Saskatchewan. They're actually excellent, and they've got good prices. You may just be able to do like one good treatment, or for a client that doesn't have fungals, you can probably leave it with them, but we would suggest, because it's single use, the whole purpose, it's supposed to be for single use, and you discard after use. So if that client has fungals, you just do not want to reuse that same tool. So we would definitely suggest, if you're using the reusable tools, that you're able to properly clean the enzymatic matter, store it, and then of course, sterilize it and then store it appropriately for reuse.
Yeah, very good. And then other people are talking about, any documentation tools and charts that they're carrying into the home, putting in a plastic bag so that, again, they can disinfect and wipe it off after they come out of the home.
Absolutely.
Okay.
And disinfection in particularly, what I would suggest is, I know that I'm not supposed to like push products. So whether it's your Coffee wipes, any kind of hydrogen peroxide. So whether it's your preamp, your TV wipes, because they will kill not only the virus, but it will kill other type of virus as well that is on the surfaces. And also we suggest you, when you do place your tools in an area, so yes, also have like a blue pad, whether the client is using a footstool, to always have a barrier. So with that barrier, you know, and this now we're talking about your foot care practice. So we also want for you to be comfortable as well, and preferably not to put the client's feet in your lap. You guys are very close and up front, but when you are providing treatment, to have a face shield on in addition to the N95 mask. Very important.
Okay. Excellent advice. So we're learning lots here today. So we're going to move just to the very last slide and just talk about accountability. So we talked about risk assessment for both the client and the practitioner. So we talked about that right at the beginning. Appropriate directives apply to foot care treatment during the emergency order. So again, regardless of how detailed we get into the actual care of individuals during our COVID pandemic, which you know, we're going to need to be thinking about for some time to come, we are still under an emergency order. So those directives from the government apply to all healthcare providers that are starting to think about opening their businesses and resuming their practice. And then again, foot care nursing is a specialty area of practice, and really being able to highlight you know, your unique knowledge that you have and the unique situations that you find yourself in terms of being able to ensure infection prevention and control practices are followed to ensure safety for yourself, your families, and your clients and their families. And so there's a big component of that. And again, we shared the links to those resources last week, but we will be sending out some other resources and a new summary updated that Bev just finalized today, because a number of the tools and resources that we recommended last week were actually updated this week. So Bev, I'm not sure if you wanted to make any comments about that at all.
What is really excellent about all this is that we have a number of foot care little associations that are making great efforts in helping their nurses and supporting their nurses. So I feel as well that whichever association that you're connected with, it's perfectly okay. So it's just a matter of, we want to be able to collaborate and share and share enough information, because at the end of the day, it's our patient, and we also have to think about ourselves as well, and we want to provide safe care. So the whole key thing is just RNAO, you've been excellent leadership in providing these resources, in helping nurses in furthering and helping clients who are very, very much requiring care right now. But at the same time, as nurses, we also want to be safe, because we're going back home to our families as well. So the foot care nurses, unfortunately, your fee will have to go up. And the whole purpose too of it's now raising the bar, and this is an essential service. And I don't know what protocols that is involved with at the ministry level in putting this as an essential services, but somehow foot care nurses got forgotten. So maybe RNAO might be able to do something about this, but a lot of people, especially our diabetics, our elderly clients, are really at risk.
Yeah, no, and this is one of the reasons we wanted to have these calls, was to get a sense of what the key issues are, not only from a clinical practice perspective, but also from a policy perspective. I will say that we have, we're just in the process of booking a meeting with the Ontario Pediatric Nurses Association. So we'll be having some discussions with them about how we might be able to collaborate further. We're fortunate that we have a forum and a membership and a network that we can reach a lot of people at a lot very quickly. And so we could see that that's been the result of a good example of that is this meeting we're having today. So again, we've had over 100 people on this call today. So I think I just wanted to thank all of the staff and team members that were on the call today. Romy, particularly, thank you for joining us and being willing to share your expertise. I'd like to thank the team of individuals that met with us earlier this week that I acknowledged previously, just to thank them for their contributions to our discussion and their understanding of all of this. I do want to tell you that we have a special place on our website where we're archiving these particular recordings from the meeting. So last week's meeting is up and on the website, along with the resources from last week. And then we'll be posting the recording from this meeting. Melissa, what's a reasonable time? When do you anticipate that we'd be able to post that? Would it be later, would it be as early as tomorrow, or probably not till later in the week?
I'm anticipating that it should be up by Friday, so this week,
okay.
And then we'll have all the resources also up on that same page.
Okay, great. So we'll send a link out to everybody with the resources. Maybe we can send the resources sooner rather than later, and then the actual recording from today will go out later on in the week. And then what I would say that we would take from this is just basically to pull together, a document with some of the content that we had discussed here today, as well as some of the feedback that we've gotten from you in the chat box, to be able to create a document that we would want to make sure that our colleagues, our foot care colleagues associations are comfortable with, but we recognize that it needs to be done fairly quickly as you're needing to be able to move forward with your practice. So I see that as our next steps. And just before we wrap up, I'm going to ask a question to see if you would put in the chat whether or not you'd like to have another call of this nature, maybe in a couple of weeks or so, to see where we are at that time and whether or not things are changing for you. So if you could just put in the chat yes or no, and that'll give us a sense of the interest in continuing some of this dialogue. Okay, my goodness, okay. Yeah, we can look at the timing, but it seems that there's a lot of yes pleases, so that's good. That tells us that there's a need, and we'd be happy to help support it. And again, we may look to see if we can have members from some of the foot care associations join us on the next call, just to provide input related to the work that they're doing and how they're supporting foot care nurses in their specialty area of practice. So with that, I'll thank you all again for joining us today. And we'll look forward to seeing you maybe in a couple of weeks to sort of regroup and see how things are going. But in the meanwhile, we'll work on pulling a protocol together that we can share more broadly that can help support you in some of your decision making related to opening and resuming your practice. So have a good afternoon and happy June. Take care. Bye for now.
Thanks, Romy.